Rational emotive behavior therapy is a form of psychotherapy created by Albert Ellis in the 1950s. REBT is based on the premise that whenever we become upset, it's not the events taking place in our lives that upset us, it is the beliefs that we hold that cause us to become depressed, anxious, enraged, etc. The idea that our beliefs upset us was first articulated by Epictetus around 2,000 years ago, when he said, "Men are disturbed not by events, but by the views which they take of them." According to Albert Ellis and to REBT, the vast majority of us want to be happy. We want to be happy whether we're alone or with others. We want to get along with others, especially with one or two close friends. We want to be well informed and educated. We want a good job with good pay. And we want to enjoy our leisure time. Of course, life doesn't always allow us to have what we want. Our goal of being happy is often thwarted by the slings and arrows of outrageous fortune. When our goals are blocked, we can respond in ways that are healthy and helpful, or we can react in ways that are unhealthy and unhelpful. Albert Ellis and REBT posit that our reaction to having our goals blocked, or even the possibility of having them blocked, is determined by our beliefs. To illustrate this, Dr. Ellis developed a simple ABC format to teach people how their beliefs cause their emotional and behavioral responses. At point A, something happens. At point B, you have a belief about the situation, and at point C, you have an emotional reaction to the belief. For example, at point A, your employer falsely accuses you of taking money from her purse and threatens to fire you. You believe, "She has no right to accuse me. She's a bitch." At point C, you feel angry. Now, if you held a different belief, your emotional response would have been different. The ABC model shows that A does not cause C. It is B that causes C. Although we all express ourselves differently, according to Albert Ellis and REBT, the beliefs that upset us are all variations of three common irrational beliefs. Each of the three common irrational beliefs contains a demand, either about ourselves, other people, or the world in general. These beliefs are known as the three basic musts. First one, I must do well and win the approval of others for my performances, or else I'm no good. The second one, other people must treat me considerately, fairly and kindly, and exactly the way I want them to treat me. If they don't, they are no good, and they deserve to be condemned and punished. And the third one, I must get what I want, when I want it, and I must not get what I don't want. It's terrible if I don't get what I want, and I can't stand it. The first belief often leads to anxiety, depression, shame, and guilt. The second belief often leads to rage, passive aggression, and acts of violence. The third belief often leads to self-pity and procrastination. It is the demanding nature of the beliefs that causes the problem. Less demanding, more flexible beliefs lead to healthy emotions and helpful behaviours. The goal of REBT is to help people change their irrational beliefs into rational beliefs. Changing beliefs is the real work of therapy and is achieved by the therapist disputing the client's irrational beliefs. For example, the therapist might ask, why must you win everyone's approval? Where is it written that other people must treat you fairly? Just because you want something, why must you have it? Disputing is the D of the ABC model. When the client tries to answer the therapist's questions, she sees that there is no reason why she absolutely must have approval, fair treatment, or anything else that she wants. Albert Ellis and REBT contend that Although we all think irrationally from time to time, we can work at eliminating the tendency. It's unlikely that we can ever entirely eliminate the tendency to think irrationally, but we can reduce the frequency, the duration, and the intensity of our irrational beliefs by developing 3 insights. First one, we don't merely get upset, but mainly upset ourselves by holding inflexible beliefs. The second insight, no matter when and how we start upsetting ourselves, we continue to feel upset because we cling to our irrational beliefs. And the third insight is that the only way to get better is to work hard at changing our beliefs. It takes practice, practice, practice. Emotionally healthy human beings develop an acceptance of reality, even when reality is highly unfortunate and unpleasant. REBT therapists strive to help their clients develop 3 types of acceptance: unconditional self-acceptance, unconditional other acceptance, and unconditional life acceptance. Each of these types of acceptance is based on 3 core beliefs. Unconditional self-acceptance is based on, I am a fallible human being. I have my good points and my bad points. There's no reason why I must not have flaws. Despite my good points and my bad points, I am no more worthy and no less worthy than any other human being. Unconditional other acceptance is based on the following 3 beliefs. Other people will treat me unfairly from time to time. There's no reason why they must treat me fairly. The people who treat me unfairly are no more worthy and no less worthy than any other human being. And unconditional life acceptance is based on the following 3 beliefs. Life doesn't always work out the way that I'd like it to. There's no reason why life must go the way I want it to. And life is not necessarily pleasant, but it is never awful, and it is nearly always bearable. Clinical experience and a growing supply of experimental evidence show that REBT is effective and efficient at reducing emotional pain. When Albert Ellis created REBT in the 1950s, he met with much resistance from others in the mental health field. Today, it is one of the most widely practiced therapies throughout the world. In the early days of REBT, even Dr. Ellis did not see clearly that consistent use of its philosophical system would have such a profound effect on the field of psychotherapy or on the lives of millions of people who have benefited from it.